What I thought I might talk to you about today is what to expect when you come to us for your first appointment. If you've never been before, then what are we going to do? What are we going to ask you? What are we looking for? So essentially, you've got a problem with your feet or your foot. You've booked your appointment. So what do you need to bring with you on the day? What sort of questions are we going to ask you? And essentially what we're going to do during that appointment. First of all, we'll take from you information regarding yourself, like your name, your date of birth, address, GP, etc. And then we'll move on to any health issues you've got or have had in the past, and any medication you're taking. So please do bring with you a list of any tablets or medication you're taking at the time. And this is really, really helpful for us. Any information you give us is treated with the strictest of confidence. We follow all the GDPR guidance and medical records guidance, so we keep all these stored completely confidentially. And if we ever need to contact a third party on your behalf, like your GP, we will always ask you for your consent before we do this. So once we've done that, we're also, while we're chatting to you, we will be looking at your feet. We'll be making a lot of mental notes that we might not be actually asking you outright if you're having any issues with, but we'll be taking lots of information on about how they look, how they feel, all of these things. So we're actually doing a lot of our assessment while we're actually chatting to you. When we've got all that information, then we will record your pulses. So we'll feel with using our fingers for foot pulses, see how they're going, if we can feel them, how robust and healthy they feel. We will also do use this piece of kit, which is a Doppler. And what this does is this allows us, it's a Doppler ultrasound, and this allows us to listen to the health of the vessel. So it's a bit like what people use when their midwives are listening to babies' heartbeats. It's exactly the same sort of technology, but essentially we're using it to listen to the health of the vessel. So we listen to the blood passing through the vessel, and that makes various sounds, which allows us to hear how elastic those vessels are moving, and so it gives us a pretty good picture of how your circulation is actually performing. So again, we'll do those on foot pulses within your feet, and we'll also use another piece of kit, which is this, and this is called a monofilament. So essentially this long piece, now I've extended out, it's a little piece of plastic, and every time we press that against you, it doesn't hurt at all. It looks a bit scary and people freak, but actually it is literally just a piece of plastic. So when this presses and bends, that's exerting 10 grams of pressure. So it's a measurable piece of information for us. So we'll use that in various specific parts on your feet, and we'll ask you if you can feel those. And that gives us a picture of how your sensation is working. So how your feeling senses are working within your feet, because some conditions can cause a loss or a lack of these sensations, diabetes being probably the front runner in those. So when we've done all of those things, obviously we'll chat to you about what problems are you having, what are your symptoms, what brings on these symptoms if it isn't glaringly obvious. I mean, obviously if you have a huge corn sat on your toe, we can quite comfortably say that that is what is causing your pain. But then we can also discuss with you, why is that corn there, what we feel is causing the problem, and discuss with you on how to alleviate symptoms. And we'll also treat the problem that you come to us with. So if it is something like a corn or an ingrown nail or big chunks of hard skin, obviously we can do all that during that appointment. Now, removal of corns and hard skin are generally pretty painless. You might feel a little bit of discomfort because often these areas are quite sore to start with, but more often than not we can actually alleviate a huge part of your symptoms, if not all of your symptoms, within that initial appointment. So going forward, depending on how complex your health is and what your needs are with us, we will discuss with you any things that you need to be doing at home to move that forward, if we feel any referrals are appropriate. Now, often when we're checking circulation, we find things that you may not have been aware were even there, and quite regularly I'm referring patients back to their GPs for further investigations with regards to their circulation or their heart. These assessments were not just looking at the feet, we're looking at the body as a whole. So we're taking into consideration lots of different elements that you probably aren't even aware we're actually doing. So we will make any referrals if we feel they're necessary, but obviously, like I say, we will discuss if you're happy with us for us to do that, because consent is a huge part of our assessment. So when that's all done, we'll again discuss with you going forward, do you need to come to us regularly? Would that be of benefit to you? Sometimes it's just that one-off initial treatment and you're good to go, and you know where we are if you ever need us again in the future. But sometimes it is beneficial to you to see us on regular occurrences, and it's up to you to decide that frequency. We will never pressure you to be coming back at a certain time frame. If you want to do that, then of course we're more than happy to see you. But at the end of the day, you call the shots. It's entirely up to you how often or how little you come and see us. I hope that's been helpful to you, and help allay any concerns or fears. Again, any questions, please just drop us a line. We're more than happy to get back to you. Hope to see you again soon. Bye.